and that lets you save.
We work with a lot of individuals with autoimmune disorders, and a lot of times people, as I said, they just don't know that there are other treatment options available that are much safer and much more effective. And that's where I think we really shine.
Welcome to Exploring Mind and Body with Drew Tadia. Drew is an expert in nutrition, fitness, lifestyle, and more. And he wants to help you live a healthier, longer, and more active life. Now here's your host, Drew Tadia.
Welcome to another edition of Nationally Syndicated Exploring Mind and Body. Thank you so much for being here. Thank you for tuning in, for being a part of our True Form Life community. We're coming at you with a brand new show. We appreciate whether you're listening on terrestrial radio across the country or as a podcast around the world. We certainly wouldn't be here without you. So stick around. We got all that coming up.
This is Exploring Mind and Body. Naturally improve your lifestyle one show at a time with your host, Drew Tadia.
All right, welcome to another edition of Nationally Syndicated Exploring Mind and Body. We have Dr. Aimee here with us, so without further ado, welcome to the show.
Drew, thank you. It's a pleasure to be here on Exploring Mind and Body. I'm looking forward to our interview today.
Yes, I'm excited too. So I always like to give our audience a chance to resonate with our guests a little bit. Can you tell us who you are, what you do, maybe how you got into it?
Yep. So I'm a double board certified licensed integrative and interventional clinical psychologist. I've got a postgraduate specialization in functional health and wellness. So I've been studying functional medicine for the last 10 years. I'm the director for the Center for Integrative and Functional Health and Wellness here in the Chicagoland area. And our focus is on really resolving the root cause, taking a very holistic approach. So again, it's a pleasure to be here.
Wow, that's a whole lot going on. How long have you gone to school for, or forever?
10 years, but that, you can do the math there. But yeah, 10 years and then consecutive studies after that, just continuing education, those kind of things, and further training. So, but it's a joy. I'm passionate about learning.
So how did you get into this functional medicine? Where was your passion that was like, I need to help people change their lives?
You know what? I was an individual practitioner, a clinical psychologist. So I did a lot of therapy with individuals, couples, and families. And over the course of my career, I consider myself to be a very, very good psychologist, a great therapist. But my clients were hitting a ceiling on, the benefits they can get because they were struggling, most of them, with health issues, either acute health issues or chronic health issues. And as I, my passion for learning took me into functional medicine, I actually had a very dear friend diagnosed with a chronic degenerative illness, as well as some family members. And when I started learning about complementary and alternative treatment modalities for their health issues, that's when I really started getting a better understanding of the role of body and mind. And that was what brought me into integrative healthcare, is because I realized if I only focused on the mental, emotional aspects of treating somebody, they were going to have limited results. So open an integrative practice, got a great integrative and functional medicine doc on board. She also practices family therapy, got an integrative psychiatrist, other therapists, and it's grown organically from there, really out of the need. Because, like I said, I want to make sure that people are in a position that they get the holistic health care they need.
Okay, so tell me the difference between how you started. So you started out as a psychologist?
Mm-hmm. Yep.
And then are you still doing that, or do you use both forms in your practice?
I do, yeah. So having studied functional medicine, when a lot of times clients come to see me at our initial interview, I'll have them go through a very detailed health questionnaire, detailed social history, emotional history. We'll review trauma. And with that, we determine, what their goals are and what's the best way to get them there. And so I can help educate them about, all right, so it sounds like you've most likely got these underlying health conditions, but I always tell people I'm not a medical doctor, but I'm going to make a referral to our physician who can follow up with you. And so right from the first time I meet people, I let them know, especially if it's a chronic condition, it could be post-traumatic stress disorder that's affecting their body. They could come to see me for family issues, but they also have health issues. I help them understand the impact of, hey, if we don't take care of your health, you're not going to be in the most powerful position to take care of your family. So I always help them understand the integration the connection between mind and body.
Awesome. Okay, so when someone comes to you, I'd imagine there's a wide array of reasons people come to you, but can you give our audience a chance to understand more specifically? So if someone comes to you and they say, I've got some issues, fill in the blank, what's one of the first things that you start with, or how can you begin to help them?
Yeah. So I'll say, I'm glad you're here. I always, thank them for their trust and confidence. And I'll ask, what brings you in today? And they'll, briefly tell me, and I'll say, you understand that, we're an integrative and holistic healthcare practice. So, we're going to look at things, in a totality. And I say, listen, I want to learn more about what's going on with you mentally, emotionally, as well as physically. I want to understand how it's affecting your life, right? Your relationships, maybe your job or your school. How's it affecting you, physically? How's it affecting you even financially? And then based on, what you're dealing with and, how it's affecting your life and what your goals are, we'll talk about next steps. And it may be to work with our integrative chiropractic physician. It may be a referral for ketamine therapy, for example, if they're dealing with some sort of trauma-related condition. But that's basically how I sum it up, because I do want to make sure I understand what's going on mentally, physically, and emotionally, and then how it's affecting their life, and then help them understand that there's more than just one road to the top of the mountain, as the proverb goes.
Yeah, absolutely. There's so many ways to get to your end results. And I think if we looked at different angles, we could get there a little bit quicker.
Yeah, sure. That is true.
And then so for you, is there anything that you specialize in specifically when someone comes to you, or do other people refer their clients to you for a reason? Yeah, both.
So I still do a lot of psychotherapy. I do a lot of teaching, a lot of functional medicine teaching. I will do wellness webinars. We've got what we call a wellness warrior curriculum, and I teach that. And some people come specifically to me for consultations for transcranial magnetic stimulation. Basically, that is an FDA-approved treatment for treatment-resistant depression. It's been proved successful for resolving anxiety, PTSD, chronic pain conditions, and so many clinical conditions. So a lot of times I'll do consultations. I'll do what we call peak wellness consultations. Those are our functional medicine consultations. And from there, I'll get them connected, with the appropriate doc. So I do a lot of individual, psychotherapy. I do some couple psychotherapy, but I do a lot of consulting. I also do life coaching as well. So, having the mix keeps me busy, but I'm really probably the central provider at our practice that, is well-versed in taking that integrative role and then helping people, get to the services or providers they need. Okay, so that's cool. You like it? I love it. I love it. What is it that you enjoy so much about it? So really helping so many people, Drew, don't know that they have more options than just the conventional medicine. Because in conventional medicine, you're basically given two treatment options, medications or surgeries or procedures. And so many people are led to believe that if they're on a medication, they're going to be on it for the rest of their life. And in most cases, that's simply not true. I mean, one of our sweet spots and one of the things I educate our clients about is if you've got a chronic health condition, again, it could be, chronic depression, it could be, chronic pain, it could be fibromyalgia, whatever. Most of the time, if they are willing to take a different approach, a more integrative approach, diet, nutrition, exercise, finding ways to feed your soul, a lot of times those chronic conditions can actually be reversed. I mean, we are experts at treating chronic conditions. It could be diabetes. It could be thyroid conditions. Like I said, we work with a lot of individuals with autoimmune disorders. And a lot of times people, as I said, they just don't know that there are other treatment options available that are much safer and much more effective. And that's where I think we really shine. And that is a joy to me to see someone, go from here to there, achieving their health goals. Oh my God, it's really rewarding. It's fantastic. In fact, when I say it, I get goosebumps. And that's something, I'm proud to say that 92% of our functional medicine clients they get exceptional results because we lay things out very systematically for them. We take a deep dive into the health, focus on their gut health, their neurotransmitter health. We look at, are they having, food sensitivities that's actually causing their depression, their anxiety, what's happening in their body that's maybe exacerbating their OCD or their trauma, because it's all interrelated.
So what happens when people come to you and they say, I've been on a handful of medications or are,
Mm-hmm.
How do you explain to them that there's another way? Or do they already know that before they come in?
Yeah. A lot of times people know that. A lot of times people don't. I'll say, all right, so let's review the medications you're on. And I'll say, have you talked to your doctor about the possible interaction effects? Because, Drew, here's the thing. If someone's on 4 or more medications, the likelihood is there's some sort of negative interaction effect among those medications. And a lot of times they'll say, no, my doctor's not done that with me. I'll say, all right, so that's something we want to explore. I'll actually run through our software with them and show them, what they're taking and then what the interactions are. And again, I always give the caveat, I'm not a physician, I can't tell you to get off your meds but based on what you're sharing with me and based on, these interactions, I'm going to recommend you see, one of our doctors, or I'm going to recommend you go back and talk to your doctor about either changing your meds, discontinuing some, or what you can do naturally to mitigate some of those interaction effects. Most of the time, a doctor will just say, here's your medication, call me in 2 weeks or 4 weeks. So it's a big deal. We see it's something called drug cascading all the time. You get one drug and you get side effects, so they prescribe another. You get side effects from that, so then they prescribe another, rather than treating the root cause, which is, what we focus on. When you get to the root cause of what's what, you can resolve it.
Yeah, mind-boggling to me. And I actually heard, I'm not a doctor. I don't pretend to be one on the internet, but I've read that they do studies on a medication, on the single medication. They don't do studies on combining 2, 3, 4 different. So they don't know what the side effects are. Is that right? Would that be correct?
There's a lot of truth to that. The person who knows the most about medications, your pharmacist. So I would say if you're being prescribed a medication, say yes when your pharmacist offers you, hey, do you need to consult with me? Yes. Can you please help me understand, how this medication might affect my other medications?
So when you started your clinic, did you know that you wanted to have such a holistic overall aspect, or is it just kind of slowly grown like that?
It's kind of slowly grown. I knew when I started, I wanted a psychiatrist that was open-minded, that was focused on interventions other than just medication. And then it kind of, organically grew from there. And I said, all right, so we've got this psychiatrist on board, but so-and-so is having this health issue. And it seems to me like their doctor really isn't understanding them or giving them the time they need. Maybe we should bring on a family medicine doctor. So we did that. And over the course of the years that she's been with us, she's gotten certified in integrative medicine, functional medicine, nutrient therapy. So it's really grown organically from the need.
So help me picture your clinic. How many, you have employees working in there, or are you referring them to? So
I'm glad you asked. So all of our team, they're all in-house. They're either independent contractors or they're employees. So, very rarely do we have to refer out. I mean, those are the cases where maybe somebody does need to see a specialist, a cardiologist, or maybe a neurologist, or they need some sort of imaging. Maybe they need an X-ray or an MRI or maybe a DEXA scan or something like that. But pretty much, the beautiful thing about having those providers in-house, Drew, is I can collaborate with them like right away. I can send them a note. We can talk, confidentially in one of the offices. So we don't have to wait on other providers to even call us back or send us medical records. So we always collaborate. So that's one of the nice things. When people choose to work with us, they get the privilege to work with the whole team. And then we're going to, do grand rounds and say, all right, how's so-and-so doing? What do we need to tweak? What do we need to add or augment? And so people get better a lot faster when you take that collaborative team approach.
Has it been a challenge to put the right people together?
Oh, yeah. I think that's the most challenging is getting the right mix. We've worked with our fair share of, duds. But we've got some really great people on board. And, I think those are the lessons you learn as you go. It's like you do the best you can, and then you kind of course correct along the way.
Yeah, I appreciate your honesty. I feel like there's as entrepreneurs that run businesses, finding the right people is probably the hardest thing. We deal with. It is.
And I've had my fair share of setbacks. I've taken my licks. There's no doubt about it. As you know, as an entrepreneur, that's going to happen. I think, I'm at a point now where I just build it in the equation. I say, all right, if we want to bring on this service, like we're now bringing on stem cell services for regenerative medicine, we've got a ketamine, side to our practice. I'm like, all right, we'll get some really good consulting. And if we, make some mistakes in marketing or what, we'll course correct. We're not going to make mistakes in how we treat our clients and patients. No way. But, as it relates to, launching new services, those kind of things, we just got to build it in the equation. That's how life is. It's a learn as you go proposition, I think.
So what does the future look like for you guys? Are you working on bringing on new services, or are you working on anything specifically with your current clients that's anything new or different?
Yeah, so we're excited. We just started offering bioidentical hormone replacement pellets. So most people from chronic stress, whether it's their lifestyle, their work, other issues, most people are hormonally depleted, if you will, whether it's low testosterone or imbalance. So we're excited that we brought on bioidentical hormone replacement pellets because they dose more consistently, and usually people feel better, honestly, within a first week or two of getting their hormones optimized. So we just brought that on. We're really, really excited about it. Like I said, we've just launched ketamine. So IV ketamine infusions, it's fantastic results for chronic pain disorders, anxiety, treatment-resistant depression, OCD, migraines, fibromyalgia, those kind of things. So we're really excited about that. And I said, we're now doing stem cell regenerative services. That's pretty cool. We do want to get to a point where we open some other practices, but I want to make sure that we continue to get better and better at what we're doing currently, and then maybe expand out.
Yeah, that's awesome. I think that's important. You know, in business, especially when we're working on health, like I have a lot of people that ask me for entrepreneur advice and like, how do I get a new product and a new idea? And I'm like, well, just make sure your current products are where they need to be before you go and start looking for new ones. So
yeah, and I've made that mistake before. I opened another location prematurely because I was excited. The opportunity was there, but the infrastructure wasn't there. So we ended up closing that practice, and, it turned out to be a really good experience. I was disappointed, we closed it, but the lessons were invaluable. Now I know what needs to happen in-house. I know about the infrastructure, and I know that we, above all, can't sacrifice care to our clients and patients, in lieu of, expanding the practice. We just can't do that. So I like to say, I like to say that life has either been a series of successful accomplishments or successful lessons. That's the way to put it.
That's a good way to put it. Tell me about the stem cell. I'm interested in this. I've heard about it a bit, but I don't know too much about it.
Yeah. So unlike a lot of other types of pain management, like plasma stuff or prolotherapy. So we're doing amnio stem cell injections, and it's really, really good for joint pain, whether it's a joint in your finger, maybe it's lower back, maybe it's hip, maybe plantar fasciitis, maybe it's elbow or tendon stuff, and it actually helps your body regenerate itself. And we take it from the placental stem cells, so it's bioidentical, and it really, really works well to help heal the body and not just treat the symptom. That's something we're very passionate about. Is we don't just want to treat the symptom; we actually want to resolve the root cause. And the stem cell, services allow us to do that. Is if there's a joint in your body, that has been in chronic pain, and you're a good candidate for it, that's an opportunity to recover fully and much more quickly.
So maybe you need to repeat that, or maybe I can ask you to repeat that. How do you know if you are a stem cell candidate?
That's a great question. So a lot of times, first of all, if you've got a chronic issue, and if it's not structural, right? If you need a hip replacement, you need a hip replacement. So if it's not structural per se, but chronic joint pain, and in order to qualify, and it is covered by most insurances, Drew, so that's kind of cool. You need to do other conservative therapies first. Maybe it's chiropractic, maybe it's acupuncture. It could even be Tylenol. It could be a pain reliever. It could be physical therapy. But if you've done other conservative treatment approaches first, and you still are dealing with chronic pain, chronic joint pain, again, it could be shoulder, it could be elbow, you're most likely a good candidate for stem cell injections.
Okay, so the reason I'm asking is because I have a family member, and they had been having knee issues for quite a while. Like it randomly swells. They have a hard time walking on it. They've had knee braces. They've had chiro, massage, acupuncture. And then it was recommended possible knee replacement, which they don't want to do. And then I was looking around and I was like, well, I've heard about this stem cell therapy. And so that's what I was asking. Is that something that would be of interest?
Yeah, it sounds like they could be a really, really good candidate. And I'm glad to hear that, the knee replacement is something that they don't necessarily have to do or want to do, because if they can explore stem cell injections as a viable option, it sounds like it can be a really good deal. Did anybody diagnose what the actual cause of that is? Because that's where obviously you'll want to start.
Right. I think they're having a hard time. I think it was a bone spur initially.
Yeah.
But then it's been really hard because nothing has helped. Like they've tried a number of different things and nothing has made a difference. So I'm not sure if that helps.
Yeah. Well, without being a physician, but based on what we're learning here, it sounds like they could be a really, really good candidate for stem cells. And amnio stem cells are great because again, they're one of the few types of stem cell services that are actually covered by most insurances, at least here in the States.
And so what is this? Like, what are you doing? Like physically, specifically, they're just injections.
Yep.
So what are you injecting?
The stem cells from the placenta, amnio stem cells from the placenta.
Okay, and that just goes straight into the area that's inflamed or has the issue.
Yep, that's exactly right. It goes directly into the area that's inflamed, and it goes about its healing job. It goes about regenerating. It's pretty remarkable. You'll definitely want to, work with somebody that's, trained in, regenerative stem cell services for sure. But yeah, it's an injection right into the site. And you can, if you need multiple, injections, typically you start with one injection and see how you do. But, if you've got, multiple areas, your insurance will allow you in most cases to get one injection a day. So maybe they get an injection right into the area of inflammation in the knee, but maybe they've got shoulder pain too. They can do that as well.
And then there's no downfalls, like side effects, for example.
This is a beautiful thing about stem cells. I mean, you certainly want to, you may have to do some physical therapy after, depending on the extent of the injury, and whether it's acute or chronic. Usually that's part of the process. For most people, maybe, they need to wear a knee brace again until it stabilizes, because it's going to start to work right from the time it's injected, and it's going to continue to increase in that healing ability. So somebody, may need to do some physical rehab, at least in the short term, depending again on the extent of the injury that they're treating.
And then is there a limit to, so like look at a cortisol shot, for example, you don't want to do that too often.
You don't. And those have long-term negative side effects, as well as a lot of other pain-relieving injections. They've got some long-term side effects too that, really, really need to be discussed. So for your listeners or your family or friends, if they're considering injections for pain management, and there's a time and a place, I like to say, for all forms of healing. If someone's in pain, manage that pain while you go about resolving the root cause of that pain. But a lot of those things can have some long-term negative side effects, and you'll want to absolutely discuss it with your doctor. Just say, hey, all right, so I understand this, the cortisone shot, might help me in the short term, but what's the long-term impact of this? Because a lot of times it can actually cause a degeneration.
And then with the stem cell, you don't have to worry about that.
No.
Okay.
But take care of your body nutritionally, because if you're not taking good care of your body nutritionally, getting enough sleep, it's going to, cause inflammation, and it sets you up for maybe a re-injury someplace else.
I interviewed, just before we wrap things up here, I'm interested in the ketamine.
Oh, the ketamine. Yep, ketamine.
So I did interview someone on that maybe a couple of years ago, but refresh our memories here. Just tell us what it is briefly and how it can help.
Yeah, for sure. So ketamine is an old school anesthetic, right? Often used, for surgery for your anesthesia, that in microdoses has been proven to be remarkably successful in, resolving all kinds of chronic conditions, depression, anxiety, OCD, migraines, post-traumatic stress disorder, for example. It actually, the ketamine infusions are the most effective, and they're dosed over about an hour's worth of time, and they actually start to open up different neural pathways than what is affected by traditional SSRI medications, your Zoloft, your Paxil. So instead of, accessing, this neural pathway for medication, your brain is actually able to, incorporate the ketamine. And when you pair that with psychotherapy, the outcomes are even better. There's on average about a 70% success rate with IV ketamine infusion therapy, much less with Spravato. That's the FDA-approved nasal spray, but it can still be effective. But IV ketamine infusions have, like I said, proven remarkably helpful, even in children and adolescents, especially in people it's indicated for people with chronic conditions, that they've not responded to psychotherapy or first-line medications like Zoloft or Paxil.
So could I get them?
You absolutely could. You absolutely could.
Can I just say I need some, is that cognitive function, like clear your brain, make you feel better about yourself?
A lot of people have done ketamine that don't necessarily have chronic conditions because it does open up more pathways. A lot of times people say it's as though the fog has parted, you can see blue skies again. So sometimes ketamine gets a bad rap because it can be abused, much like Ritalin or Xanax can be abused. So a lot of times people just don't know that ketamine is a viable option for treating chronic conditions.
Have you tried it?
Remarkable, though. I've not. Though
Do you want to?
I'm curious. I probably will.
You what? You probably will?
I probably will. The thing about IV ketamine infusions is, as I said, it's microdosed. It's microdosed. So you're not going to have that hallucinogenic experience. It's just going to make you feel relaxed and then open to healing.
I think I'd like to try it just to see what it's like.
Yeah, me too.
I'll have to take a trip to Chicago to come and check it out.
There we go. On the house, Drew. On the house.
Okay. Dr. Aimee, is there anything that we missed that you wanted to discuss?
No. I just, really want to thank you for the opportunity. I would encourage, anybody dealing with a health condition to ask a lot of questions. Insist on getting your questions answered. Please be open to addressing the root cause of your health issue, whether it's a mental health issue or physical health issue. And please don't just accept the status quo of you just have to learn to live with it or you're going to be on medication for the rest of your life, because that's absolutely not true.
Tell us where we can find out more details about yourself, your services, what you do.
Yeah, for sure. Our phone number in the U.S. is area code 630-980-1400. You can check us out online. Our website is www.thecifhw.com. Again, thecifhw.com. You can find us on Facebook at facebook.com/thecifhw.
Awesome. All right, Dr. Aimee, thank you so much for joining me today on Exploring Mind and Body.
My pleasure, Drew. Thank you so much. Look forward to talking to you soon. Bye-bye.
All right, that's going to wrap things up for this edition of Exploring Mind and Body. Once again, thank you so much for being here. Thank you for tuning in and being a part of our True Form Life community. You can always find us on facebook.com/trueformlife. We post up there a couple times a day on our story. We're always trying to bring you more content around living a healthy lifestyle, whether that be nutrition, fitness, lifestyle, and more. We also have free challenges that we do at least once a month. So if you follow us along there, you'll be able to join maybe a plank challenge or a squat challenge, Tabata challenge, whatever it may be. We'd love to have you join us. We're also on Instagram.com/DrewTadia. Again, we're posting up there a couple times a day along with our story, all dedicated to keeping you fit and healthy and on track. Our main website is trueformlife.com. If you want to check out some of our products, some of our services, or if you just want some great content from videos to blog posts and recipes and more, we got all that at trueformlife.com. Once again, thank you so much for being here. That's it. That's all I got. I'm out of here. As always, I'm your host, Drew Tadia, in health and fitness for a better world. Thanks for listening.
You've been listening to Exploring Mind and Body with Trueform Life's Drew Tadia, fitness expert. To find out more about the show, Drew Tadia, or to listen to past shows, visit exploringmindandbody.com.